back stiffness, neck pain, limited mobility. These issues can affect how you work, move, and feel every single day. Hi, I am Unnati Patel, physiotherapist at Impact Physio and Sports Clinic. As a physiotherapist, I use different mobilization systems to help restore smooth and comfortable movement. Today, I will walk you through two of the most effective techniques, Maitland and Mulligan, and how I decide which one is right for your spine. What is the Maitland Method? The Maitland Concept is a gentle, evidence-informed approach that uses graded oscillations, small rhythmic movements applied to stiff joints. This helps decreases pain, calm irritated nerves, and slowly improve joint motion. I choose Maitland when someone comes in with sharp or reactive neck or back pain, localized stiffness, pain triggered easily by movement, stress-related muscle guarding. It's a calm, precise approach, perfect for sensitive spines. What is the Mulligan method? The Mulligan technique pairs joint gliding with your own movement. That means you bend, turn, or twist while I guide the spine into an optimal position. This technique is my go-to when pain appears only during specific motions. Movement feels blocked or stuck, joint alignment is slightly off, and you need faster mobility improvement. A Mulligan glide can often produce immediate changes, which keeps patients amazed every time. How physios choose the right one? When you come in, I pay close attention to how your pain behaves. If your spine is irritable, inflamed, or guarded, I usually begin with Maitland to calm things down. But if movement itself creates the discomfort and a slight joint correction removes that pain, that's when Mulligan becomes the ideal choice. Many times, I combine both. First, relax the joint, then retrain the movement. After the right spinal mobilization, most people feel a smoother range of motion, less tension, and easier bending or turning. The goal is simple: better movement with less discomfort, so you can get back to your day feeling more at ease.
Maitland and Mulligan FAQs. Can Maitland mobilization be used on sensitive or painful spines?
Yes, Maitland's grid oscillations are gentle and controlled, making them ideal when spine is reactive, inflamed, or needs slow desensitization.
Why does Mulligan often work instantly?
Because it corrects minor joint positional faults while you move. When the glide restored alignment, the painful movement becomes smooth again.
Do these techniques replace exercise?
No. Mobilization improves mechanics, but exercise builds strength and control. Together, they deliver longer, lasting relief.
How does a physiotherapist decide which method to use?
They test movement patterns, check joint response, observe irritability levels, and choose the method that reduces pain during the assessment.
Are Maitland and Mulligan safe for all ages?
Yes, when applied by trained physiotherapists, techniques are adapted to your comfort, mobility level, and spinal condition. If back or neck stiffness is limiting your daily activities, the right mobilization technique can make a meaningful difference. At Impact Physio and Sports Clinic, I am here to help you move better, feel better, and understand what your spine needs. If you enjoyed this breakdown, hit like, share, and explore more educational videos.